Some Democrats have proposed health care cooperatives as an alternative to the government-run program. Co-ops are nonprofit, member-run groups, usually on the local level. Critics, however, say the co-op isn't a practical option on the national level. Dana Bash has our report.
I'm going to give you one of my cards.
For Dr. Eric Seaver, giving out his card is a ticket to more efficient health care.
I do 350 or more emails a month with patients. It saves them having to get in the car to come over here.
Dr. Seaver says he can take time to email patients because he's paid a flat salary, not per office visit, and uses electronic records to collaborate with colleagues.
We have primary care, specialty care, pharmacy, physical therapy, all of the home care, all of those services, and we are able to communicate and coordinate our care.
This is GroupHealth, a cooperative in Washington state, which supporters of a co-op approach to health care call a model. How does it work? GroupHealth is a not-for-profit health plan governed by its consumers, patients. Its 11-member board is elected by co-op members. The co-op covers 600,000 people. A central question is, will this kind of co-op in Washington state work nationwide? A key Senate supporter says experts tell him yes.
They think there would be 12 million members in very short order, that it would become the third largest insurer in the country and would provide meaningful competition.
Do you believe that?
No.
Why not?
Because I just can't imagine how that would happen again.
But this healthcare expert says it would be tough to convince enough patients to enroll and enough doctors to participate.
All of the things that you have to do to start up an insurance company are not the kind of things that just a group of people getting together at the diner on Saturday morning and saying, let's start a co-op can do. You just don't see it happening.
What about another central goal? Providing competition to insurance companies that leads to lower costs. Again, skepticism.
I think it's going to be very unlikely that a co-op is going to get better rates out of providers than a commercial insurer.
But back at the GroupHealth co-op, they say streamlined systems have led to reduced costs. The reality is it has taken 60 years for this co-op to build success.
And when it comes to policy and the politics of healthcare, it's hard to imagine there would be patients to wait even a couple of years, much less 60, for co-ops to get up and running nationally and be successful. Now, in terms of cost to the taxpayer, that is, right now, Senate negotiators are talking about providing about $6 billion of seed money for co-ops, but many experts think it would take a whole lot more than that. Lou?
So what's the answer? No, I'm just kidding. I'm just kidding.
Which question?
I love the idea that this whole issue is being discussed as if it were so simple that it could be co-ops, it could be a government-run option, it could be absolutely free enterprise entities, for-profit entities, when there has been no public debate, no public discussion whatsoever of the facts, the context, the environment, which are integral to whatever solution is provided. This has been one of the most remarkable moments in American history in the discussion of public policy because there are so few facts, so little understanding of all that is involved, the environment, if you will, of the issue and its ultimate prescriptions for resolution.
It's true, and I get, as somebody who was standing outside of the negotiations that were going on before Congress left for recess for basically months, and talking to senators coming out, we knew that this was on the table, that the public option in the Senate was off in terms of these negotiators, and that they were talking about co-ops. But even right before they left, just trying to get some details about how this would be structured, how this would be fashioned, it was very hard to get, and that's because even though they've been talking for months about it, they don't really have a lot of details yet. They're still working it out, and that just goes to show how tough this is, but also what a long road they have ahead, especially on this issue.
Now, you're sure they were working, right?
That's what they say.
Dana, thanks a lot. Dana Bash from Washington.